we've basically created our own app. It will be called IA Community. By the end of Q1, we hope to have this app downloadable for free. Are HA fillers dead? Basically, the answer is no. There will be a new product launched that's a hybrid filler. So it's both a mixture of biostimulation and HA filler.
People are coming in now more frequently for smaller treatments, maintenance, and for business owners, it's about adapting their business to be able to accommodate the shifting trend. I was out to lunch late last year in the plastic surgery space, and all their patients are not using Google anymore. They're using ChatGPT and Grok and all these other AI bots. It's aggregating information, and it's really changing the way people are doing their research.
But I do think, and I've said this before and everyone laughed at me, I think within 5 to 10 years, robots will be injecting people, and I stand by that.
That's crazy.
Welcome to Inside Aesthetics, the world's leading podcast for cosmetic practitioners and business owners.
Our podcasts are aimed at medical professionals and should not be used to make medical, legal, or financial decisions. You should get an appropriately tailored piece of advice from a professional in your country.
To show your support and stay up to date with our latest episodes, click the follow button if you're listening on Apple Podcasts or Spotify. And if you're watching our episodes on YouTube, hit the subscribe button as well as the bell icon.
If you're interested in joining our online community, being a guest on the podcast, or would like to work with us, all of our contact details are in the show notes. And now, let's jump into today's episode. Welcome to 2026 and chapter 16 of What's Trending in Aesthetics.
Happy New Year.
Happy New Year.
Did you have a nice little break?
I did. It's, as you said, it's kind of weird. We went from like crazy year, stop, a few weeks off, and now just back into it at 1,000 miles an hour. So it's a bit of a shock to the system.
My first day back yesterday and it's just all gone bananas again. Emails and meetings and Zooms. It's all happening again.
Yeah.
So for this episode, What's Trending in Aesthetics, we thought we'd talk about themes and broader concepts that we think may or may not be relevant for 2026.
Yeah, so we've done a bit of research, a bit of Googling, speaking to people, clients, partners, colleagues overseas. So I guess we just put this together based on a lot of different feedback from different places. So theme one is, and we touched on this a little bit last year in previous episodes, but around the concept of rather than people coming in for 1 or 2 major treatments a year, it's now shifting to multiple maintenance visits, and then how that's intersecting with the longevity-based themes, I guess, if we want to call it that, and how it's all working together.
Some people calling this slow aging. I know that the word aging triggers certain people and all this kind of stuff, but yeah, so that's theme one, I guess, maintenance and thinking about more longer term goals.
Yeah.
2, again, this isn't a new theme, but most people still think that biostims have superseded HA for whatever reason, and we certainly saw a drop off in HA last year, but I've got my own thoughts. I think HA is going to come back.
Yeah, well, you gave a couple of talks last year on that I saw, so I think it's fair. I think like everything, there's always like an overcorrection. So there was all this negative publicity around HAs, and then there was the knee-jerk reaction for people to just kind of almost stop it or heavily reduce. So we'll obviously get into that.
Yeah. The third one,
well, devices, or the case for devices in your clinic, and the way people are thinking about different platforms, because we've gone from an industry where you'd have multiple devices doing specific indications to the rise of the multi-platform device, which is, I guess, not new, but it's becoming more of a predominant theme within people's clinics, and choosing the right one.
Yeah. Just rationalizing your spend, basically.
Yeah.
Third one, and I think this is a big one, and again, this isn't news, but maybe it's good to talk about specifically, it's the professionalisation of aesthetics. Moving from what some still or did consider beauty to medical treatments.
Yeah.
And the implications for what does that mean for running a business?
And the way you advertise it, potentially.
Correct, and regulation, etc. And then that's not really a theme, but I think it's certainly good to lean into and think about as a business, is that patients are much smarter, educated, and they're doing their research on us now as practitioners and as businesses. They're getting much more savvy. So kind of a theme that our patients are changing. And also one thing that we were talking about off air is new demographics of patients, Gen Z, kind of a new niche that we're now needing to think about specifically to cater for.
Yeah.
So,
and I guess how AI's affecting that as well. Like, I was out to lunch late last year with a couple of surgeons in the plastic surgery space, and all their patients are not using Google anymore. They're using ChatGPT and Grok and all these other AI bots. and it's aggregating information, and it's really changing the way people are doing their research.
100%.
Yeah.
And then if we have time, I might mention a few specific product or types of products that I'm fairly certain are going to launch this year.
Yeah.
But let's see if we have time for that.
Before we jump into that, though, we've got some pretty exciting news, and this is, I guess, just a preliminary announcement, but with a lot more information to come. I'll let you make the announcement, Jake.
All right. Well, let's think about how we say this. So this podcast should be out the 30th of January. So for the last, 7 years, to be honest, since we've been doing the podcast, but certainly the last year, Dave and I have realized that podcast has been wonderful, serving a huge purpose for education, and you guys get a lot of value from it, and it stands alone as a platform. But we've been planning and plotting something even bigger than the podcast.
Yeah. Well, I guess that kind of dovetails into our Patreon community. And I think that some people know what Patreon is, some people don't, but essentially it was our way of providing on-demand additional content outside of what we do on the podcast, as well as creating a community for people to come together, communicate, share ideas, ask questions, etc. And it's never really been exactly right. First of all, it's hard to communicate what it is. It's clunky. It's jumping across multiple ecosystems. And so I guess with what you said and what I've just said, we've looked to create something bespoke and customized to help the community at large, as well as create a better home for our existing, I guess, Patreons. It will no longer be called that anymore. So what have we done about it?
Well, so we've basically created our own app. It will be called IA Community. Whether it's available at the time of this coming out, probably not, but we're certainly in a beta version. We've got a working app. I've got it on my phone, and we've been playing around with it and building it for months now.
Yeah.
But we're probably in a beta phase where we'll invite our existing Patreon community and people already subscribed to our various things to play around with it, give us feedback. But certainly by the end of Q1, we hope to have this app downloadable for free.
Yeah.
Go to your app store on your phone or Google Play Store, and we want to involve way more people than we have currently involved in our community. Anyone listening to this podcast, plus partners, companies, therapists, business owners, basically, if you're involved in this industry, you will have a purpose to download our app because there'll be a lot of free stuff. Of course, all of our podcasts will live there. There's going to be a few things that I guess we can announce now, such as a live conference diary. So you can look at the year's calendar wherever you are in the world and see what cool things are happening around you. Mm-hmm. We just want to connect and make our industry make a bit more sense. Mm-hmm. Yeah. So I guess that's all I'm willing to say for now.
Yeah, no, it's pretty exciting. As you said, there's going to be a huge freemium component. That's the term that people are using now. So even if you don't want to become a paid subscriber, we've designed this app to be hugely beneficial for you, even if you don't never pay us a cent, in terms of community, central resources, clinical libraries, all that kind of stuff. So stay tuned. It's coming very soon.
Yeah. And if we do have something more to say, there'll be a link at the bottom of the podcast.
Exactly.
But I doubt it. It's only a few weeks away and we're still tinkering around the edges. Okay, let's get into this podcast. So the theme that we titled, just to give us something to talk about, was maintenance and longevity-based aesthetics. So, I mean, let's talk, I guess, from a business perspective. You speak to a lot of injectors, business owners, and of course, there's been this big trend to lean into regenerative aesthetics, menopause, even weight loss in certain countries. And, you know, we're not just offering wrinkle treatments anymore. Yeah. So was that the basis to this, of branching out and offering more things?
Yeah, and I guess the term longevity might mean different things to different people. And when we're talking about maintenance treatments or pre-rejuvenation, which is, I guess, what some of the younger generation are calling this particular phenomenon, I think it's all of those things. I think that, as I said, and when we were sort of discussing this at a high level, was that people are coming in now more frequently for smaller treatments, maintenance, looking to get ahead of the aging process before it starts to become majorly problematic. And for business owners, it's about adapting their business to be able to accommodate the shifting trend or the theme that's sort of sweeping across the industry. So I think it incorporates all those things, and people are kind of trying to figure out, okay, well, do I bring on a therapist? Do I start offering skin treatments? Do I start consulting for GLP-1s? What's the story with other peptides? Hormone replacement for women? Getting a multimodality device? I think it's all of those things, changing their consultation structure, the way that they communicate to their patients. I think it all falls under that umbrella.
Yeah. I mean, have you seen your business clients actually seeing their patients more?
Yeah.
So what? How more frequently, and what are they doing in those treatments?
So I mean, what I've seen from a lot of the people I'm talking to, and the great thing is I talk to people all over the world, so this isn't just an Australian-centric piece of feedback. It's from talking to people in Europe, the United States, and so on. So people starting to, if they aren't already, they're offering skin treatments in their clinic. They're either bringing on nurses to do this or specialist skin therapists. They're looking to change their consultation structure to look at, I guess, overall treatment planning, which they should have always been doing to begin with, but I think we've been spoilt in a lot of ways where it's just sort of been relatively easy to kind of just say, oh, show me the wrinkle and I'll get rid of it kind of situation. So it's more about looking at things holistically, treatment planning, making sure people are rebooked into their calendars, so paying more attention to keeping people within their business and being proactive about it. And then, I guess, looking to the horizon of how they educate themselves on, you know, more of the longevity, hormonal side of things as well.
Yeah. And what challenges have people found implementing that? I mean, obviously, you know, getting new staff on new devices, that's fairly understandable. But if you want to retrain and learn about a new specialty like menopause medicine or weight loss, so that's not always easy.
I think the first challenge is there's a paradigm shift in their own mind around, as you said, learning a brand new skill set. So once they've come to the realization that they need to be more than just the person that takes care of the wrinkles and the depleted face, is where do they get educated on this? Who do they talk to? Who's the trusted source? How do they become credible? How do they confidently start talking about these things? It's kind of like ultrasound. Everyone wants to do ultrasound, but where do they learn? There's a steep learning curve. It's a complete paradigm shift.
Yeah.
And so I think a lot of it is just people scrambling to find out, well, what should I be offering? Because you can't do everything. I mean, the term longevity is quite broad. So what do you actually pinpoint as wanting to be a service or product that you want to integrate into your business? Does it fit within your model? Is it correctly targeted at the patients that you're seeing in your business?
Yeah.
Is it all going to fit? And then, you know, do you have to bring on, you know, other staff members to complement what you're doing? You know, the risks and costs associated with that. Do you need other equipment, other products? So it's kind of people almost reimagining their business models entirely from the ground up, which is not easy to do.
Yeah, I've spoken to a couple of senior colleagues and, you know, people maybe at the tail end of their career, and they've voiced to me, maybe understandably, that this is not going to work for them. Like they're sort of not energized, you know, from a business perspective, from a motivation perspective, to actually want to lean into effectively a new specialty, and they're just going to, you know, carry on. And I don't think that's a bad thing. That they've just realized this is maybe just. It's coming. It's probably going to be fully developed in the next 3, 4, 5 years, and maybe I'm just too late. That's something that I think some injectors have also realised.
Yeah, and maybe just been honest with themselves around whether they want to make that big change at this stage of their career.
Yeah,
and potentially for some of those providers, they've got a certain demographic of patients that might be happy to carry on with business as usual and sort of not change the way they're thinking. But I guess for the younger generations, like the Gen Xers, the millennials, the Gen Zs, like that's the people that I think are collectively the dominant force, whereas baby boomers, I think, were the dominant force for a long time, but now they're kind of starting to become more of the minority.
Yeah.
I mean, did you see that in your clinics as well? Or?
Yeah, look, I don't actually know what 2026 holds for me in terms of I'm going to change my practice. Probably not, but I'm really keen to learn some of those new skills, new products, add to my knowledge base, etc. I just don't know. I've had discussions with patients. So, for example, I've said to, you know, my menopausal patients, you know, we talk about this stuff all the time. I talk from an aesthetic and a more holistic perspective, but I'm not offering you the service. And currently I don't have a really good referral system. I know 1 or 2 people that I might refer to, but it's not really a joined up service where we can cater best for our patients. So if I could do more in-house, that would be awesome. So yeah, I am thinking personally, how would I add that into my own practice? How might I adapt my consultations, even my prescribing practices? But it's not something that I can just switch on overnight. It's going to be something that I have to aim towards for maybe a year's time. But I think, if you're running a business or you're just a solo injector and you're contracting, if you're not thinking about how I'm going to evolve, that could be a problem.
Yeah.
So I would strongly suggest, even if it's not really your jam at the moment, to at least think about it, look into it, work out the lay of the land.
Yeah. And maybe start thinking in stages and mapping it out over the next 2 to 3 years around, well, what would you like your practice to eventually look like in a perfect world? And then working backwards from there and maybe start with, okay, well, what can I start with today? What treatments can I start implementing? Where can I start educating myself and becoming more in that patient's life than, just as I said, the person that takes care of the wrinkles.
Yeah, I mean, I think our fifth trend with more savvy patients will drive that. Whether you like it or not, our patients are going to demand these things. So if our patients are getting savvier and asking for stuff and you don't offer it, they'll go somewhere else.
Yeah. And then I guess from the business perspective, it's just about understanding that, your business and this industry is its own living and breathing entity, and it's going to change and evolve over time. So, those big ticket treatments where you might be getting thousands of dollars for a single treatment, they're probably becoming less frequent, and you might be able to speak to this in your clinics. It's probably people are spending less in one hit, they're coming in more frequently, and the dollar amount per transaction is less. So you need to start thinking about how do you adapt your business model to suit that.
Look, every patient is different, of course, and some of my patients still want something specific, and as long as it looks good, I'm happy to do that. But yeah, I mean, I've got many patients I've had for years, and I'm just as guilty as they are. They haven't really thought out of the box of doing anything more than toxins, for example. And we get into this lovely relationship where I see them 3 or 4 months, and it goes on for years. And I've been saying to them, because the new year's a good time to sort of reboot this relationship.
Yeah.
If you're up for it, so it's not pushy or salesy, I'd like to just sort of take a step back, get a fresh set of photos of you, do a little bit of a longer consult. Maybe we'll book another 15 minutes, rather than just doing your toxin again. And let's just relook at things, almost like reconsult. Yeah. Exactly. That works for some patients. Some are up for it and some don't care, and that's okay.
Yeah.
But I do think that you need to start maybe targeting some of your patients who maybe you have underserved because you've slipped into that routine, and I'm guilty of it just as any other injector, and just open the door to more possibilities again. And New Year's a good time to do that.
Totally. And so I think that might need to start changing the way in which you're, as you said, doing your consultations. I think that focusing on the aging process or the rate of aging, why that's important for us to focus on, what are all the other factors that influence this beyond what I can do with a needle. And I guess talking about, trying not to radically change yourself, but maintaining like a baseline over like an extended period of time.
Yeah.
Rather than looking for radical, dramatic changes.
Yeah. I mean, the one outlier to what you just said is I think that ablative laser is becoming more popular.
Yeah.
That sort of redo of looking like you've got baby skin is coming more accepted. I mean, some of the downtime you can't avoid, but some of the lasers are getting a bit better. And I think, because of the whole Kylie Jenner's mum, Kris Jenner, with her sort of look and makeover, people are understanding that is a semi-achievable result with the right tool, and sometimes it's an aggressive laser. So the one outlier to a radical change is I think ablative laser will become more popular. But yeah, these radical, 20 mil transformations, I think will become less common.
Yeah, and maybe something else to talk about as well is just the impact of GLP-1s and how that's changing the way that you maybe approach a face after rapid weight loss, how you're consulting your patients. Are we looking to different tools within the tool cupboard to assist with that? Because Dr. Tavakoli, who we had on recently, was talking about how it's changed his surgical practice.
Yeah.
Like the demand for liposuction has basically vanished. Facelifts are in high demand again, body lifts, removing excess skin, and just, breast augmentation. So, has it impacted your practice and the patients that you're seeing and the way that you're approaching that?
There are lots of patients on GLP-1s, but it's still a minority.
Yeah, okay.
I think here in Australia, I can't remember the figure we quoted, it's probably several 100,000 people on a GLP-1, but it's not like America, where it's really every second person seemingly on one. But it will trend. It will becoming more and more popular as some of these products are now licensed for weight loss rather than diabetes. It will become more accessible to the general population. And then we'll get a new generation of those GLP-1s that don't affect the muscle.
Yeah.
Or so on. So there'll be less and less side effects and more used probably.
Sure.
So again, I guess you just said another theme, body aesthetics as well as face. And of course neck, that sort of transition zone where we traditionally maybe have underserved and undercatered for.
Yeah, sure.
So yeah.
And I guess maybe just to finish up on this point from a business perspective, and I would say this not so much as a warning, but just to be mindful of the way that these trends start to play out. If you don't start thinking like this, your business won't just disappear or vanish overnight, but you will start to notice, less new patients coming in, maybe the patients that you thought would rebook in, maybe don't. Sometimes it's a death by 1,000 cuts. You won't notice a complete evaporation overnight, but you'll start to notice a trend over a period of time where you'll just start to have more gaps in your calendar. And just don't be complacent. You've always got to be thinking about, how do I reinvent myself or my business? A couple of times a year, at least once a year. How do I continue to push the envelope? Because complacency is what kills businesses. Yeah. And we've seen it over lots of industries over, many, many decades. It's a pattern that keeps repeating itself. So don't ignore this stuff. Yeah. I guess would be my advice.
No, really good point. And even if, you don't want to reinvent yourself, you need to remember that your patients are still seeing all this stuff on Instagram. Yeah. So even if you don't want to change or add in a new service or a new device, your patients might still be asking for it or reading about it. And if you don't answer the questions of why you have or haven't changed your practice, they will leave potentially. Mm-hmm. So yeah, just think from the patient's perspective of what are they seeing out there.
Totally.
Okay, the second one that we have highlighted was, the 2025 big theme of biostimulation.
Yeah, and the death of HA,
Yeah, and if you missed it, we did a really good deep dive on biostimulation with Dr. Ferial Fanian.
Oh my God.
A wonderful podcast. I really enjoyed that, and we need to get her back maybe
she's
this year.
Fantastic, yeah.
But I think we all know, and we've probably spoken about many times, that we've saw a huge drop in HA use and a big up spike in biostimulation, whatever your flavour of choice of product was. Mm-hmm. Now, first of all, you agree with that, right? That's what happened?
Totally.
Do you think it's going to get bigger, continue?
I think it's probably reached a stable place in terms of, I don't think the drop-off's going to be any more. And if anything, I think it'll probably start to rebound a little bit, because I think there was a lot of things going on at the same time, which was the rise of just all these extra biostimulation, bioremodeling. We've got exosomes, polynucleotides, the old players sort of reinventing themselves. So there was a whole lot of hype around a different segment of anti-aging options, plus all of the horror stories around overfilling. There's, some big personalities online that have created a lot of noise and negativity and I guess fear around HAs. And so I think all those things combining, plus the ticket price of HAs, I think that kind of made a real impact. But like anything, like no single tool is going to be, a panacea. Like I don't think, these biostims are going to be the answer to everything. We still need HAs, and I think people will realize, okay, I still need these, maybe not as much. I'm going to think about my strategy a little more. I'm going to use them in combination with other things. Yeah. What do you think?
Totally agree.
Yeah.
I did this talk when you were there in Egypt and Canada, like, are HA fillers dead or finished was the title of my talk, and basically the answer was no.
Yeah.
But like you said, there's been so much hype and driven by patients because of what they're reading, that injectors were forced or given many other options like biostims, polynucleotides, etc. So if you imagine the pie basically was toxins and fillers 15 years ago or even 10 years ago, that pie has got bigger with more categories. Mm-hmm. So just by definition, HA filler use will drop because there's more options, but it doesn't mean it's a bad option.
Yeah.
And if you need volume, shaping, contouring, projection, HA still is the only option, in my opinion. I mean, sure, you get a little bit of volumization with some biostims and so on, but if you need something immediately reshaped, less hollow, a lip fuller, you need an HA. Mm-hmm. You can't really do it with anything else. Yeah. So, yeah, that social media-driven trend, hopefully, I think has seen its peak. Of course, I still use HA filler, and yes, I use less of it because I've got more tools, and I have done lots of biostimulation, but I still need HA. So I think we're going to see, like you said, an equilibrium where things stop being so unbalanced and they come a little bit more back to an equilibrium.
Do you think that this highlights the importance of the consultation process? Because now there is that negative connotation out there in the marketplace. People can hop online and see all these negative stories about HA. So do you find that you've had to adapt your consultation process, the way you explain things, because you still use HA fillers, but maybe patients are a bit more apprehensive, and what have you done differently?
Yeah, I haven't really adapted it. I mean, I certainly, very often, I maybe don't do it every time, I say to my patient, I know that you've read some stuff online. Yeah. Tell me the biggest, scariest thing that you don't want to do today, or a version of that question. And inevitably it's migration, overfilled face. I've heard that skin quality is more important than, blah, blah, blah. And so we lean into that. So it's kind of a useful thing to explore, because you're showing empathy, that you understand where they're coming from. you're showing that you've got knowledge and you can tackle these questions. But also, if you don't agree with it and you think they need an HA, then you can explain why and allay their fears. So, yeah, I mean, of course, patients come in with questions and fears and worries and their own ideas about what they need, but give yourself time in that consultation just to lean into it and explain why you would or wouldn't choose a product.
Yeah, you raise an interesting point around the assumption that patients have seen negative stories, and I think that's really powerful around bringing up the concerns, like up front, like addressing the elephant in the room. Yeah. And saying, look, I know there's been a lot of negativity around HA. These are the things that have gone wrong. These are the negative stories that you would have seen. This is why these things are being said. But putting all that to one side, this is why I'm recommending this. This is how we avoid those things becoming horror stories. This is my approach. So you're almost dealing with the objection before the patient even has a chance to bring it up.
I think it doesn't work all the time, or sometimes it's not relevant, but if you notice that they are a little bit anxious or they've avoided using the word filler or whatever, then lean into that. That would be my suggestion.
Yeah.
I mean, the other thing to say is I think that we haven't seen the end of biostimulation. I think there's going to be more products and more variants. And I mean, for example, it's not really a trend, but there will be a new product launched probably end of Q1 by one of our big brands, at least here in Australia, that's a hybrid filler. So it's both a mixture of biostimulation and HA filler. So it's yet another tool that you kind of get the best of both worlds in some way.
Yeah.
And maybe that would be a great option for a particular niche of patients.
Yeah.
So I think biostimulation, rather than just this bracket of biostimulation, you will choose particular ones for that particular patient's needs. So one biostimulator, I won't name any names, might be a bit more punchy and be better for sort of more global areas.
Yeah.
And you might choose another one that you have in your cupboard for more specific areas and a lighter touch, but they're both biostimulators.
Yeah. The use of fat is becoming more trendy again, particularly for surgeons that are doing procedures like liposuction, and they'll harvest some fat whilst they're there. Yeah. From my understanding, it's still considered the gold standard product to use when it comes to filling, because it's your natural tissue. What we're trying to replicate with filler a lot of the time are those fat compartments.
Yeah.
Do you see a day, and I know there's some products overseas in the States that we don't have here, but do you see a day, or have you heard of a product that's going to be able to predictably stimulate someone's capacity to regenerate their own fat in a controlled way?
So the one that you're alluding to, I think it's called Renuva.
Yeah, it is.
It's cadaveric matrix that then stimulates your own fat to grow. I mean,
would that be the holy grail if you could do that, do you think?
See, here's where maybe I'm just blinded because I'm an injector and I'm not a surgeon anymore. But of course, fat you're replacing like for like.
Yeah.
So from that perspective, it's a gold standard filler because it's you and it's your material. But it's got many problems. One, the fat that you inject doesn't sort of hold, and you lose about 70% of it, depending if it's nanofat or it doesn't really matter. But what you inject is not like for like, so that's one potential problem. Two, you've obviously got to harvest it from somewhere. That's kind of a procedure. Three, if you want to tinker with it, change it, dissolve it, you can't. It's there.
Yeah.
So yes, it's gold standard like for like, but there's some trade-offs. Whereas with filler, it's not like for like, but wonderfully adaptable, moldable. You can add to it, you can dissolve it, you can. It's kind of like a great happy medium. And assuming you don't have a VO or a blindness, there aren't too many serious problems with HA filler.
Yeah. Well, you could have a VO with your fat.
Well, correct. You have a fat embolism.
See, I envisage one day where they'll just be able to replicate your own fat from like a DNA sample, and they'll just harvest it, and you'll actually grow your own fat somewhere. Then you'll have it injected, or they'll be able to predictably cause your body to start generating it again. I don't know. That's kind of what I think will eventually happen.
I'm sure that in whether it's 10 years or 50 years time, we'll look at what we're doing now and say it was ridiculous. Just like we look back at what happened 100 years ago with surgery. It looks ridiculous, but at the time it was
you won't wear gloves?
What, you can't spit into the wound? Sure, things will evolve, but I think what I'm trying to say is the tools we have are pretty good now for what we're trying to do.
Yeah.
I know we've spoken about regenerative aesthetics and moving into, stem cells, all that kind of stuff. But what we're trying to do, fill cracks and fill volume, the tool we've had, it's been around for 30 years plus, and it still works really well.
Yeah. What about using HA and biostims together. So I know you said there's some products coming out that are kind of combined.
Yeah.
But have you experimented with different ways in which you combine that multimodality approach, particularly with biostims and HA together?
I haven't. I mean, one, because I've got two tools that kind of do the same thing. I can just do them separately. But two, I think we've touched on it before in a previous, maybe what's trending. I don't want to be like a home cook. I don't want to be like a mad professor with, syringes and cocktails, just trying stuff. I'm not saying that you will always have a problem. I don't know what those problems are because I've never done it. So maybe I'm too conservative, but
I guess what I meant more was, are you kind of changing the way that you would plan a treatment course? So because you if I think back a few years ago when you weren't even using Sculpture, you were like, pretty much exclusively an HA and toxin guy, right? So how's your practice evolved now to when you see a patient in front of you where you might start with HAs, and how have you adapted as someone that was very much in one camp previously?
I think the biggest evolution was when Profilo launched about 2022. So not that long ago, maybe 4 years ago, but it was this new category of injectable that was neither a filler nor a toxin, and not a skin booster. It was different, and we call it a bioremodeler. And I know that's confused you, but it's a bioremodeler. So it allowed me to do something different, but to explain to my patients, now we're not just going to fill a crack or freeze a wrinkle. We're going to do something different. We're going to modify your tissues to make you age better. So it allowed me to change the language of my consult and to change the paradigm of what my patients thought I could do, to stop them wanting that instant gratification. It was more, okay, I'll do this now, a bit like a fertilizer, but we won't see the result till next season. So changing the mindset of instant gratification to aging better. So maybe that was the biggest change, but of course we've now introduced Sculptra, we've got polynucleotides and all sorts of stuff. So my patients have seen that every time a new thing has come on board and I've spoken about it, it's allowed me to expand their mindset. And if you haven't done that as an injector, you need to, because even sort of the most limited way of injecting, there are lots of products now. It's not just toxin and HA. There's just so many categories and classes that if you're not catering to that demand, then you're really missing out.
Yeah. Okay.
So right, we've probably done that theme to death. Let's move on to device rationalization and platform thinking. So I guess the underlying message of this theme was 2026 is about simplifying tech, not chasing the next device launch per se. So again, wheel this back to business first of all. Back in the day, there were clinics with 10 lasers and
have rooms
Davin
dedicated
Lim's got about 100 and each one costs several $100,000. And if you've got the money and the space, it's not really a problem, but most people don't have that advantage. So, you've touched on going back to maybe more multimodal platforms rather than individual indications. Mm-hmm. So is that what you're seeing?
Yeah, and I think maybe to go back even a step further, and maybe this is a piece of advice as well, and it will sound obvious once I say it, and I'm sure many people have already thought about this, but you really need to start with who are the patients that you're catering to, what are the indications that you're seeing. That's kind of the starting point for everything to do with any business, really. Who's your customer?
Yeah.
So once you understand what problems you're trying to solve, then you can go down the path of looking at which device is going to match the majority of patients that I'm seeing. So I kind of like to work on, the 80-20 rule. You probably find that 80% of your income comes from 20% of your treatments. So starting with the patient in mind, what are the indications that you're seeing, and looking at how you can actually match the device that's going to give you A, the capacity to treat those indications, B, have the capacity to maybe add more things onto it in the future. So a lot of the devices that come out now, you can add additional hand pieces, so you might have something that has like an IPL or BBL component to it that's going to treat, your vascular lesions to a degree, sunspots, freckles, so on. I won't talk about melasma. That's kind of...
but common things that many patients have.
Right. And then you might be able to add on like an erbium, a fractionated erbium or a CO2 or some sort of skin or RF device. So you've got the capacity to kind of add on to this in a single platform.
Yeah.
Which obviously makes it, as you said, space effective, cost effective, and allows your device to grow with you as it becomes a bigger part of your business.
Yeah.
So I think that's kind of obvious, but maybe not so obvious to some people.
Yeah, and again, these aren't like new trends, but really thinking about, like you said, patient demographic, but also utilization of your space, staff.
Yeah.
whether you do it or you employ a specialist to run that device, all this stuff can't just be, not thought about. You actually have to have a specific business plan and strategy that you lean into.
Correct. And so, I was just talking to a client this morning who's getting a new device from our friends at LaserAid. Hi, LaserAid. And I was having a discussion with her around, okay, what this device is arriving in such and such a date. Like, what's the plan? And there was no plan yet. There was no sort of thought process around, okay, well, how do I make sure that, I know how much I need to generate from this device every week to not be costing the business money, who's going to be operating it, is there any opportunity cost to that? So if you're taking resources, so whether it be a staff member, whether that be yourself or someone else, the room that you're doing it in, if I put this device there, what impact does it have on the rest of my business and the resources? How I'm going to communicate it to patients and get them excited about it, and sort of just start planning for success rather than just getting excited about the device and then it arrives, but you haven't actually thought about, okay, the moment that device hits your clinic floor, it should be all systems go. You should have it all kind of planned out, and a lot of people don't do that. It's kind of like an afterthought, like, oh, it's here, okay, what do I do?
I think a good example of that, and this isn't aimed at a particular company, you would have seen those pelvic floor chairs that you sit on. Now, that's a wonderful device, and it certainly helps people with pelvic floor problems, but it doesn't necessarily dovetail into a normal aesthetic practice. But many people bought them thinking, well, this would be cool, have it in my waiting room, and I'll suddenly start talking about incontinence in the middle of my wrinkle consultations. I mean, you can do, but if you don't think about it, plan it, get your patients hyped up well before the device has arrived, it could just sit there in the corner and be a bit of a weird, quirky device that no one uses. So it's that kind of planning, I think, that you are alluding to. What about the next trend? I think this one's really key. And again, we would have definitely mentioned this before on the podcast, but it's the professionalisation of aesthetics.
Well, what do we mean by professionalisation? Let's kind of maybe unpack that a little.
So every injector we've ever had on the podcast, and I'm no different, has kind of fallen into this industry. Maybe that's changed now in the last 3 or 4 years with people specifically training in nursing to become an injector. But by and large, we were doing another job as a doctor or a nurse or even a dentist and randomly stumbled into aesthetics, and now you're an injector. So we all don't have a formal training pathway. We probably don't have our finger on the regulatory landscape until we're kind of in it. And, many people open their clinic not having a freaking clue what they're doing. So it's that lack of professionalization that I think hasn't really been thought about in any explicit way. And I don't think you can really get away with it unless you lean into it in 2026. Especially if you're going to open a clinic, you really need to be all over this rather than let it just happen. So that's kind of the background.
Yeah, again, I'm almost sick of saying it, but the industry has gotten to a point now where you really need to be more sophisticated with what you're doing and sort of think about all other industries and look at the effort and planning and foresight and budgeting that goes into opening up another business in, I guess, a more seasoned industry. And if you're not doing that, as you said, especially for new entrants, it's going to be a tough climb. For a lot of people. And I guess the professionalism even goes beyond that in terms of like how we advertise ourselves, the impact that increased regulations having on, things like social media, your website, the use of before and after images, the claims that you're making around the products and services that you're offering within your clinic. And then, sophistication from patients. So it's forcing us to up our game, to level up in terms of how we run our businesses, how we communicate our patients, how we educate ourselves, and how we advertise. And it's coming all at the same time.
I still think that patients are very swayed on what they're seeing on social media. And of course, here in Australia, there's many things that we can't do now. But if you're an American injector or you're running a clinic in America, maybe some of the things that we're saying maybe seem a little bit conservative or stuffy, and you can still get away with many things that we can't do here. But I have really enjoyed some of the things that I've noticed in my patients who are coming in now. They're way savvier, they're way more educated, they're way more researched, and they're clear what they don't want. They might not know exactly what they want, but they're very clear what they don't want. And, the clinics that are maybe not leaning into education or showcasing ethics and professionalism, even if you are a professional person, but if you don't showcase it and and really shout from the rooftops of why you are an ethical injector in whatever way that means to you, patients may not select you because of that. So that's what I'm seeing.
Mm-hmm. And so how have you shifted your practice? I mean, not saying you weren't professional before, but like what things have you changed and implemented?
I mean, when I could, scream from the rooftops on Instagram, I always made a point of trying to show my differentiation, whatever it was, whether it was results, my philosophy, whether I agreed or didn't agree with something. I really tried to signpost who I am as an injector. Whereas now, I obviously can't do a lot of that on Instagram, but I've certainly made my website black and white clear on what I do, what I don't do, why you might choose me. If a patient landed on that page, they'd have a very clear idea of who they're going to meet, on the day. Mm-hmm. Whereas I think many clinics, you just sort of go on the website, it looks lovely and it looks clean and whatever, but you don't really know who the injector is. Mm-hmm. You're not really sure of their point of differentiation, the qualifications of the person or anything like that. And that's what patients want. They want to know who's injecting them and why should I choose them.
Yeah. I guess getting back to the Gen Z thing again, they're very big on being an individual. They do follow the trends on TikTok and, Instagram and so on, but they're not afraid to ask for what they want. They know who they are. They're very specific. So, in terms of you being very deliberate about how you promote yourself, what you stand for, what you will do, what you won't do, the patients that you will say no to, I think that is key moving into the future.
Yeah, 100%. I mean, just yesterday we were talking about it again off air. I rarely see young patients, and it's not unusual, but I rarely see people into their 70s and above. And lo and behold, yesterday I had a 20-year-old and a 70-year-old who are new patients. And I had to say no to both of them for various reasons. Yeah. And, that conversation of saying no has certainly become easier and easier and easier because I've kind of signposted it somewhere on my website or somewhere on my intake form that I might say no to you.
Yeah.
So the more you, I guess, in some way try to showcase what you do and prep your patient to know what to expect on the day, they'll respect you for that. Mm-hmm. It's not always about just delivering results. It's about sometimes saying, no, I'm the wrong guy for you.
Yeah.
Yeah, and I think patients like that honesty and trust.
Yeah, authenticity, I think, is the word.
Yeah.
That tends to resonate.
How do you, when you're mentoring, say, your business, mentees or whatever, how are you explaining to them to showcase some of these ethics or these philosophies in their social media or their marketing?
Yeah, that's a good question. And I've touched on this in some recent education that I've been working on in terms of the patient journey, which is not new. Plenty of people have spoken about the patient journey concept, but I think it's evolving over time. But it all starts again with who it is that you're trying to talk to. What kind of things do they want to be educated on? It's not always about showcasing, before and afters. I think that's something that you do within your clinic now. Obviously, here in Australia, we can't signpost that.
Yeah.
But I think it's around education, your treatment philosophies, what you stand for, and really just focusing on getting your patients to feel empowered to make the right decisions and to, I guess, be authentic so that you're actually getting the right patients that you want and they are the right service provider for you. Because, often you'll get this mismatch where you won't have the right patient in your clinic. You'll end up with a book full of patients because you haven't been clear about who you are, what you stand for and what you're offering. And it can start to become a difficult egg to unscramble because you end up, turning up to a job you don't like every day. You've got, conflicts with patients that don't listen to you. So I think we are focusing on authenticity, education, knowing who your audience is, and just being honest.
Yeah. And I guess, and this isn't a knock at people who have fun on social media. I used to do loads of it.
Yeah, some crackers, yeah.
And it's important to have a little bit of fun, I think, like a deliberate showcasing of your personality. But I think patients want less of an influencer and they want more of a medical professional. That should be your number one of brand ethos.
Yeah. And I think even the term influencer has been, I think it should be redefined now. It's not, when they say influencer, I don't think it's around having, 10 million followers on Instagram. Are you someone that's authentic, that's credible? Do you have a really engaged, authentic, niche community of followers? Are you trusted, or are you just someone that's, got all these people following you and you'll say whatever you need to say to get the free treatment or the money from that service provider? I think people are a lot more wise to that these days.
Yeah, it's a good point. We've been trying to do a deep dive into the algorithms of, the various channels for our own purposes of the podcast. And, we might not get hundreds of likes on our posts, but we can look into our statistics and the amount of shares and views. These are the kind of things that Instagram values now rather than likes and followers.
Well, because you can get, bots now to do that for you.
Yeah. And so, if you haven't ever explored, and if you haven't got a business account on Instagram, that's the first thing to change to, because then you can see this stuff. But dive into some of your insights, it's called, and just look at how many people have got eyes on your stuff. Whether they like it or not is irrelevant. If there's traffic on your posts and you can see shares happening and also the proportion of followers to non-followers, it's that kind of stuff that you want to be, I guess, judging your content on. Are people looking at this stuff?
Yeah.
It doesn't matter whether they liked it, because we get loads of, I call them ghosts. They're kind of there, but they're not there. Or they don't want to declare that they're there, but we know that they're watching. So so don't worry about the vanity metrics, more so the organics of it.
Yeah, totally. Quality over quantity.
Yeah, and then we mentioned this already, but it's certainly that the fifth theme is patients getting savvier, smarter, pickier of who they let touch their face. And we've spoken about this before, but spoken our last What's Trending about the chains and how maybe they are potentially going to contract, maybe have less clinics open in the future, and certainly in less countries. So potentially patients are getting choosier.
Well,
they're not going for price now.
Yeah.
So I think that's kind of a theme that again, if you haven't worked out as a business that you can't just pull one lever on price every time. It's about your value proposition, what do you offer, how good is your consult? All this kind of stuff is going to showcase you as a better practitioner.
Yeah. Well, it's this concept, again, I'm sure someone else has thought about it or come up with it before. It's this idea of price elasticity. So if you think about price as an elastic band, and the more stretch that elastic band has in it would be akin to like how much a patient's willing to tolerate a price increase or what you're charging for your products and services. So at some point you continue to stretch the elastic band, it snaps. But up until that breaking point, patients or customers, consumers are willing to pay more if there's value for what they're getting for their money.
Yeah.
So, eventually someone would love to engage your services, but they just simply can't afford it. So it doesn't matter how much they like you. But up until that point, if you can do things to improve the experience that your patient's having in your business, and this is kind of where I start to, talk about, well, going through what does every step of that patient's experience interacting with your brand, your website, your clinic, the way you consult, the way you follow up, all of the communication in between those visits, how can you look at improving that by a few percentage points on an ongoing basis? And the more that you can do that, the more elasticity you build into your price.
Yeah.
Right. And so that allows you to do regular price increases without fear of your patients running away, because you've created that value and that people are willing to tolerate that up until a point.
Yeah.
So there's no magic bullet anymore. You can't just like pull, run, trigger, like continue to pull price and expect that that's going to continue to work, because I think those days are well and truly gone. So we need to be continually working on our business and just, it's a game of little percentage points on an ongoing basis across everything that you do. Yeah.
And going back to, I guess, how you present yourself on social media, your point of difference can't be, oh, I'm funny, or I can do a moonwalk, or the splits, or whatever your thing that initially got that patient in, to book with you. You've actually got to provide the value on the day. Yeah. So it's more about all those things that you just said, rather than just getting them in the door. You want them to be a long-term patient for life.
Yeah. So
you need to showcase your value and your brand proposition and your point of difference with your clinical acumen, not just because you're a personality.
Yeah.
I think that's, patients have realized that personalities or influencers or whatever you want to call them, that's just sort of the tip of the iceberg. There's got to be way more substance.
Yeah, it might be what you do to initially create interest or an attraction for them to find out more, but beyond that,
it's like a magic trick. Like, okay, we've seen it once, but what else do you do?
Yeah, exactly.
So those are the 5 main themes. Just a couple of things. We know that there'll be new filler brands launching, certainly here in Australia. We know that Chroma will certainly launch this year at some point. I know that Everless have launched in America with their filler brand. So more and more, I guess, product differentiation, more choice, and presumably that leads to more competition between brands and potentially this whole price war again. So that theme and trend isn't going away. That's going to continue, I would assume. Do you agree from a market perspective?
Yeah, absolutely. Yeah, there's more players across all segments of this industry, and the more players there are, the harder it is to be successful. So people will, be continuing to innovate. At the end of the day, the patients are going to be the ones that win.
Yeah.
As with every industry. So, he who has the best product offering, the best service, the best technology will win.
I mean, let's speculate, and I don't have an answer, but, up until 3 years ago, there weren't that many filler choices here in Australia. Now we've got plenty, but it's not like Europe with hundreds. Yeah. We might have 10, 12-ish, like well-known brands that are TGA approved. But once we get to the point where it is 50 or 100, do you think that both injectors and patients kind of ignore, from filler 20 onwards? Do they just...
It'll be like
is there too much choice?
I think it'll be like the first page of Google.
Yeah. Yeah, the established brands who've had that.
Well, they've had the head start.
That's it, the head start, yeah.
Yeah. I think everyone else will be struggling like below the fold or on page 2 of Google. It'll just be, you'll have the lion's share of the industry controlled by probably half a dozen key players.
Yeah.
That'll probably take 70 to 80% of the market, and then the rest will be, everyone will be fighting for the scraps. I think.
I mean, I don't have numbers, obviously, but I would assume that the pharma brands who have a filler here at the moment, there probably isn't a dominant number one.
Not anymore.
They've probably got a slice, whether it's 20%
and they probably shift positions all the time as well.
Yeah. So you think that want to be the longer term trend of obviously more choice, maybe price is a bit more affordable, but it's not going to drop to like crazy prices.
Correct. I don't think so. I think that, and again, this is kind of what I'm hoping is that, as an industry, we don't continue to race to the bottom in terms of how we price our patients. I guess the one caveat is, well, what's AI going to do? Which is kind of the wild card in terms of how that's going to influence our businesses.
Yeah.
So I don't know. That's hard to predict. But I guess if there's still human beings doing the treatments, I don't see it becoming, like getting your nails done. I don't think it'll ever get to that kind of level. But who knows with AI? I mean, gosh, in 10 years we could be in a completely different world.
Yeah.
What do you think? Do you agree? Or
who was I talking? I was talking to someone the other day about this. I think as an injector, essentially the way I see AI working or changing everything is if you work behind a screen, office or something like that. Sad to say, I think your job's really under threat within the next year.
Yeah.
Or that sort of short term.
Yeah.
I think if you're doing something with your hands, whether you're a builder, injector, a surgeon, your job will change, but you'll basically be either driving the robot or still be doing the lion's share of the work, and you've probably got a good 5 years still. But I do think, and I've said this before and everyone laughed at me, I think within 5 to 10 years, robots will be injecting people, and I stand by that.
That's crazy. I mean, even looking at the way I think it's going to impact like GP clinics, I can see like a huge reduction in the number of GPs that are required. I mean, there'll still be, people that require the interaction, and I think there's an element of importance to that, especially with certain demographics of the population.
Yeah.
But I think you could potentially have a little device in your house where you put your finger on it, takes a little swab, takes a blood sample, tells you what you're wrong, tells what's wrong with you. You'll get an automated script. Jeff Bezos will send a drone with the product to your house. Yeah. I mean, imagine how much easier that would be for people that don't want to go to a GP's office. I'll just be able to get...
Well, and it'll be accurate. For it. I mean, of course, people are going to lose jobs and it's going to be radically different. But if it improves health, efficiency, price, like I'm all for like innovation.
Yeah.
But when it comes to, I know it kind of sounds crazy, a robot injecting you. No, just like a self-driving car. It seems crazy 5 or 10 years ago, but it's fairly normal in certain cities now.
Yeah.
It's just a paradigm shift that will happen whether you like it or not.
Yeah.
So, if you can prove that something is better, cheaper, safer, why wouldn't you do it?
How long till someone replaces us on this podcast?
Well, we joke. We've never actually planned this, but maybe we will, maybe we won't. We could do an AI podcast that just clones me, clones you, and it will lean on 350 podcasts we've already done, so it will know how we speak and our personality and so on. Probably do a better job than you and me. So that threat is definitely there. But for now, hopefully the humans out there listening appreciate the artisanship that goes behind this. But I don't think it's that crazy.
IAAI.
Yeah. Last couple of things to throw out there. I don't have any inside knowledge, but I would speculate the type E toxin will launch somewhere this year.
Yeah.
So that's the short-acting toxin. So that will certainly be a new category of product. Even though it's a toxin, it does something quite different.
Which is what, just quickly?
Lasts 2 to 3 weeks.
Okay.
And it works almost immediately. So within 8 hours, it's fully locked in, and you have the result. So maybe we'll certainly do a Tox Talks when it's available, and we've got someone who's got experience with that. I did see that there's kind of a new category of device called microcoring, that they've kind of refined the technique. Okay. So basically, you put like a device on the face, and tiny needles go into the skin, but they almost take out like an apple core, but like tiny ones. Yeah. So rather than shooting a laser through like RF microneedling, these will sort of take away tiny slithers of core of tissue, and the idea is that whole core would have heal and contract and actually tighten the skin. So rather than heating the skin and hoping it contracts and tightens, this definitely will work because you've made tiny holes everywhere.
Right. Interesting.
Yeah. So that's kind of super interesting. I haven't looked into the complications or anything else. Anything else? No, I think those are the things that summarize quite well. Anything still in your chest that you wanted to get off?
No, I think I'm done.
No, you're good?
I think I'm good.
Well, hopefully you guys enjoyed that little summary of what we think is going to happen for the rest of the year. If you don't agree, you've got any other comments, either comment on our Instagram, or I don't know if you guys know, you can actually comment on Spotify. There's a section under each podcast where you can actually leave a comment for us.
Yeah, that'd be great.
Let us know. But there'll certainly be more news of our app coming, IA Community. So please stay in touch with us through our various channels so we can let you know once it's available to download. And of course, we'll let you know in the podcast when it is. All right, mate.
Awesome.
See you later.
We hope you enjoyed that episode, guys. To stay up to date with our latest news and episodes, follow us on Instagram, and we're now on TikTok.
You can also now watch our full video episodes on YouTube and Spotify. So if you like what we do, please give us a like and subscribe. Please also consider joining our Patreon for invaluable business and injectable education. Get access to our global community of like-minded professionals, hints and tips videos, bonus podcast content, and more.
All of our social links, Patreon, and contact information are in the show notes below, and we'll see you in the next episode.